These are difficult times for everyone. Just because you might not have the symptoms associated with coronavirus doesn't mean you're not a carrier of the virus or actually incubating it. We have to be careful and take the proper precautions so as not to spread the virus. Avoid touching your face with unwashed hands. That includes your eyes, ears, nose, and mouth. Clean and disinfect frequently touched objects and surfaces, as they may be a reservoir for the virus for hours or days. Keeping your hands clean by using more alcohol-based hand sanitizers or washing them with soap and hot water for at least 30 seconds is a necessary component, but is not enough to prevent spreading the virus. Avoid crowds of larger than 10 people, and try and stay 6 feet away from others whenever possible. If you have to cough or sneeze, cover it, preferably with a tissue. Throw the tissue in the trash and immediately wash your hands, or use your upper sleeve or bicep. Definitely don't cough or sneeze into your hands. If you begin to feel sick at all, stay at home and isolate yourself, and if you live with family or friends, they need to be self-quarantined. If you have a health professional, doctor or nurse practitioner, contact them for advice. They may be able to create a virtual consultation for you. If you do not have a health professional you can consult, you should contact the nearest urgent care centers and your local hospital. Check to see if your symptoms match any associated with coronavirus on the CDC website as a first step. If you have any of the COVID-19 symptoms, you should get in contact with a health professional who can advise you on the latest recommendations. You should act as though you have the virus. In the case of an emergency, such as severe shortness of breath or persistent high fever, call 911 or your local hospital. Testing for the virus should be considered following a consultation with your health professional. Some areas have mobile testing stations in addition to hospitals. You can find your local testing facility at www.cdc.gov. And this time, take additional precautions, like wearing a surgical mask and gloves or something comparable to avoid you spreading the virus. If testing is recommended by your health professional, the test is quick and you'll get your results hopefully within 48 to 72 hours. While awaiting further advice on the pandemic from your health professional and results from your COVID-19 test if applicable, be sure to self-quarantine and follow the recommended steps to help reduce your symptoms. These generally will include isolating yourself in your home, being mindful of your hygiene, coughing, sneezing, touching objects, and make sure that you're taking in enough nutrients and fluids, and possibly using fever-lowering medications such as acetaminophen. At this point, a telemedicine or virtual consultation with your doctor would be ideal. If you've taken the COVID-19 test, you will receive notification via phone, text, or email with your results and instructions on next steps. When speaking with your health professional, they should advise you if any antiviral treatment is warranted. Only if you feel significant shortness of breath should you go to your local hospital. In that case, take additional precautions like wearing a surgical mask and gloves to avoid you spreading the virus. Otherwise, for other symptoms, contact your health professional. Regardless of whether you took the test or not, you should assume you have the virus. A significant majority of individuals, such as yourself, will recover over time. Isolate yourself, drink plenty of fluids, and make yourself as comfortable as you can. Notify whomever you had close contact with in the past 15 days that you are ill. And, if applicable, have tested positive for COVID-19, and urge them to self-quarantine until they speak to their health professional. Self-quarantine really means isolation. Severely limit all physical interactions, continue social distancing while still in your own home, especially if you live with others. In this scenario, masks and gloves are recommended, and while accepting deliveries. Be very mindful about hygiene, as objects can transmit the virus and live on surfaces for days. Use this time to catch up on the things you love while stuck at home. Remember, laughter is also a form of medicine. Stay busy and maybe try exploring a new hobby or something you've always wanted to try. Get creative. Just because you're stuck at home doesn't mean you can't be productive. Be active and use this time for self-improvement. But remember, this illness can have a profound effect on your exercise capacity and overall endurance. So please proceed with caution. Keep in touch with friends and family. Remember that we're all in this together, and that our actions create a ripple effect, which is why we must be cautious and mindful at all times, not just if we're diagnosed with COVID-19. Stimulate your mind and body, and stay engaged with others while you remain physically isolated. Remember, it takes time to fully recover from COVID-19. So please make sure you remain in contact with your health professional to determine when it is safe for you to interact with others. Be advised that special precautions, such as wearing a mask, for at least the next 15 days to reduce any possibility of transmitting the virus is recommended. Eventually, we will make it through this troubling time. We'll grow from it and be stronger because of it. Take care of yourselves and each other.